It is a huge honor, beyond an honor. It's 1 in the afternoon in Phoenix, Arizona. What time is it in Italy? Where are you at in Italy?
It's 9 o'clock p.m.
In what city?
Is Ancona. It's in the middle of Italy on the Adriatic Sea.
And you are a legend. You are beyond a legend. I mean, your resume is a mile deep. You're probably most famous for you started a group, Styleitaliano. Is that how you say it?
Yes.
And tell everybody about yourself. Most of my fan base is probably 80% of this is the United States, and you're a legend in Italy and Europe, and my friends all around the Mediterranean. Tell us about your organization, StyleItaliano.org. That's www.styleitaliano.org.
Okay. We found me and another guy, the name is Walter Devoto, is a dentist in Italy, also with a lot of skill with composite materials. We found Styleitaliano in 2012, so it's a very short story. But since we found Styleitaliano, we had an unbelievable success. We opened a Facebook page that since the beginning we had a lot of fun and members that asked to enter inside our community, and we published a lot of cases following a philosophy that we was following since many years, what the philosophy of feasible, teachable and repeatable dentistry. So after that, we grew really very fast, and at the beginning of this year, we were 40,000. And now, in October, we are 80,000. So in only 10 months, we are double in number now as member. We have also a website that is www.StyleItalino.org. That is one of the most visited websites in dentistry. We have thousands of visits per week, and people stay at least 4 minutes. You can imagine how successful is the website if people stay for 4 minutes a day. It means that they are very interested. The other important thing is that in our page, everything is the first page. You have not to click many times to find what you want about article. We have more than 300 or 400 articles that you scroll, and now next month we are launching the new website that is totally different, because few months ago we launched also Styleitaliano Endodontics, that is now the biggest community in endo, because they have 35,000 members in 3 months. And
35,000?
Yeah.
And what is that website? www.StyleItalino Endodontics?
No, it's the same web of Styleitaliano shape guides. So now we have only one website where we have inside shape guides, endodontics, and at the end of the year we will launch Styleitaliano implant, Styleitaliano lab, Styleitaliano digital, Styleitaliano research, and Styleitaliano indirect, with some of the most famous people in the world that they want to follow our philosophy.
And
so
and you said it was teachable, repeatable. What were the 3? Teachable, repeatable, and what?
And feasible, in the sense that we want to do a dentistry that is repeatable, because during the years all the company, they provide materials for opinion leaders. But the opinion leaders are the only dentists, normally they don't buy materials. So that's very strange. Why to not provide materials for the GPs, for the general practitioners? And at the beginning of the story, we did consultancies for the companies about the color of the materials in dentistry. Was our specialty at the beginning. And we collaborate, and we are still collaborating a lot with 3M, that is the biggest in dentistry for composite and the world. And we manage all the work of their material. And we make consultancy about the recipe to create the perfect colors. So at the beginning, our goal, our success was to make recipes for the composite. What does it mean, recipe? Recipe means that we create the exact thickness of each layer to reach perfectly the color. So we provided a lot of recipes for many companies, and this is the starting point of Styleitaliano. After that, we have a lot of active members, not only members of Facebook. So it's a group with a lot of people. At the beginning, all of them, they were Italians, friends for sure, very young people, really talented people. But after that, we started to launch an international program. Now we have active members from Portugal, France, Spain, Ukraine, Turkey, Dubai, Czech Republic, Germany, and we have two guys in the United States. That is Professor Marcos Vargas in University of Iowa, and we have a Brazilian guy inside, and now we are improving the number of active members. What the active members do normally, they do normally cases in a very simple way. Well done, everything clean, correct, but easy to understand, because you know, normally you follow your guru. Your guru is a little bit crazy, suggest you to put 6 layers, 7 layers, 8 layers to create a central incisor, but really we don't need all these layers. That's why we started to follow a different philosophy, following overall the color, that for us is knowledge, is not art. We don't need to be artists. For sure, if you are also artist, you can create something special, but with the knowledge, you can create really the perfect restoration for the patient. So this is, in few words, our philosophy.
So it sounds like you kind of like to have a philosophy that to make it easier for the general dentist to do.
Easier the good dentist, so not easier in the sense that everything is really easy. To make a quality dentist, and after that, from the recipe, we move to the menu. The menu is for 3 different kind of level of dentistry. The first one is the street food, the second one is the trattoria, and the third one is the gourmet. So in the first level is for young people, people that start to enter in the world of composite, direct or indirect restoration, and ceramic too. So it's the easiest way to create quality. The trattoria is a little bit better. It means to create restorations in anterior with 2 layers, in posteriors using the new bulk materials that now are very powerful and useful for overall. And then to move to gourmet, adding some special colors to create the perfect restoration. But you can move in the middle of the menu, moving and starting from the street food, entering to the trattoria, until when you improve your skill to arrive to the gourmet. And we follow all the people, and we design everything to support our techniques. We have designed instruments, tools. We have some patent for the mobile telephone, that it becomes a spectrophotometer to choose the color for the tip. So you can't imagine how many things all the group normally does. And our philosophy is to share knowledge. That's why we grew so fast, because of the sharing. So normally a company want to feedback about the material, they give us the material, and 30 or 40 people simultaneously, they work on the same material for 3 months with the same techniques, with the same knowledge. You can imagine which is the feedback after 3 months. It's impossible for a company to have the same feedback with their opinion leaders, that all of them, they use different techniques, not the same. So we want to use all of us the same way with the material.
Now, to make it simpler for the listener, you're talking to thousands of American dentists. Is there a particular company? You mentioned 3M. If a dentist was trying to be more of a cosmetic dentist like you are, I mean, you're a legend in cosmetic dentistry, aesthetic dentistry. What is there any? I mean, would 3M cover all your materials, or do you use multiple different companies?
with 3M is only consultancy, but we work with all the materials. So you can reach the result that you want with all the materials available in the market. The problem that you have to change a little bit the techniques. Not all the techniques you can use the same with the different materials. You have to change sometimes the techniques. Sometimes you need 3 layers to reach the color. Sometimes you can go in mono layers if you have some material with a very great light diffusion inside. So it depends on the material. Our rule is to study the material and to suggest the best technique for this material. So it's only because 3M, it was with us since the beginning of our history that we did a lot of things with them. So that's why. But it's not only the only company that we work with now at the moment.
What other companies do you work with?
We work also with Coltin, we work a lot also with the Sply, we work also with Kerr. So we work with a lot of companies, but the main project that we have for the moment is with 3M, because they really trusted in us, because you know, they have to trust in your consultant, because otherwise it's a problem. So if you have a consultant you don't trust in what the consultant suggests you, at the end you don't reach any results. So that's why the relation that you have for the moment with 3M is very satisfactory for both sides.
You know, I'm extremely familiar with 3M because I live in Phoenix, Arizona, in the desert, but my sister is a Catholic Carmelite nun in Minneapolis, St. Paul. So when I fly to go see my sister, I go to the 3M for 4 hours and 1 minute, which makes it a business trip expense. Then I go visit my sister. And I've always been impressed at how many PhD organic chemists. I mean, their research facility is just amazing. I wanted to ask you, when you have so many different dentists from so many different countries speaking so many different languages, when dentists go to StyleItalino.org, what language is it in, or how do you go about the language issue?
No, we have only in the website the English language for sure, because it's the international language. But we are creating now a special page for USA people, because you know your philosophy, your culture is totally different than the European one. So normally the colors of teeth in USA are totally different than colors in Europe. In Europe, the most common color is A2 or A1 is the widest. In your country, you have a lot of bleached teeth. So for that reason, our recipes are totally different for USA. And we strongly believe that we need to create a special page for USA dentists, because it's not so easy for them to follow our philosophy. So, but it works. We created a lot of recipes for bleached teeth, and they are very easy.
So be honest with me. What do Europeans think of the Americans going after such extremely white teeth? Do they, in Europe, do they think that's silly or funny, or do they think they look like clowns?
You know, we feel different about aesthetic. For us, aesthetic is to imitate the nature. Is exactly the meaning of the two words that compose aesthetic for the Greek words. But after that, for sure, you know, if you go in the Middle East, and we are very famous in the Middle East. In the Middle East, they follow the USA way as the Hollywood smile, you know. And for us, it's exactly the same. So it's only the same technique, moving and utilizing different colors. It's exactly the same. It's not the problem for the technique. It's only the problem that we have to set our philosophy in the country that normally we go. When we go in the Middle East, we try to make wider teeth, only because they follow the American style. So we are not against, because this is culture. You know, I remember the first time that John Coyce went in Italy many years ago. I had a course with him, and he said, I know, you are looking for our teeth that you believe they are too wide. He said, I remember the first time that I went in Bologna, in Italy, there were a lot of trattoria. Now I have seen more McDonald's than in the United States. So pay attention, because probably in the next future people will ask for white teeth. So really it's not this the meaning, but for sure the trend is totally different. Even if I strongly suppose that now a lot of people are following European style in the sense of the color, for sure. And the other difference that there are in the United States, that they go normally for crowns. And we don't go for crowns. We go normally for partial restoration and overlays, overlays. But is a problem of the insurances normally, because in the US market, they have revenues and for the crowns with the insurance, and the insurance don't pay for partial restoration. That's also another reason for different philosophy. But I strongly believe that now dentistry is becoming a little bit more universal. So a lot of American dentists, they now are looking for European in the sense of to be more conservative, trying to do not prepare the teeth, to go no prep, from prep to less prep to no prep. Why not? Today, with the materials that we have, with the new CAD/CAMs, it's possible to work with the ceramic with 0.2, sometimes 0.1 millimeters. It means that you really can save a lot of biological tissues. Really, we are now in a world of the biodentistry, in the sense that we save tissue. You know, when you prepare for a crown, you eliminate 75, 80% of the tissues. When you prepare for the veneer, even if you are in basic, maximum you prepare for 27, 28% of the tooth structure. So why not to be conservative? You have more opportunities and more outcomes for the teeth of our patient. And you save also time. After that, if you want to dedicate more time to your patient or you want to enjoy your time, up to you. For the time that you save, if you go partially instead, you go for full crowns. But I strongly believe that this philosophy today is worldwide recognized as the best philosophy to save tissue, more than to maintain restoration in the mouth.
And it's kind of funny how, like, a person will have a worn down dentition, so the dentist, to restore the worn down dentition, will file down all the teeth for a crown. It's like, oh, to restore, you just mutilated, you just drill
this
down.
is great what you are saying, because now the trend that we have in Italy and Switzerland, that normally are the two countries that guide the dentistry in Europe, because the main speakers come from Switzerland or Italy today, is to use really for home dentition overlays, palatal veneers, vestibular veneers, and not to prepare for crowns. We use composite for function normally and ceramic for aesthetic. So it really is a world to discover, because we started 30 years ago going adhesively with a lot of restoration. And I know that in a lot of countries, they're still preparing for metal PFM crowns. So really the dentistry today is a chemistry, is physics, is engineering, and it's different. It's changed a lot, really it's changed a lot. And we need knowledges today. You have to know a little bit about chemists. What does it mean multi-mode adhesives? What does it mean phosphate monomers? How you can use the phosphate monomers to bond ceramic, to bond tooth structures. So really is an unbelievable world today. It is a challenge every day to discover something new and try to simplify the life of the GPs, because really they are the 80%, probably the 90% of the dentists in the world, not the opinion leaders. So you go in the Congress and you see one implant in the central incisor, but they show you the only one that had this kind of success, because you know, for failure in a central incisor implant is a terrible challenge. If you have a failure, you can imagine what happened. So that's really, we want to be a little bit more conservative. Even if we work with implant, we work with everything, but we want to work in a different way. Try to save tissues.
So Go ahead.
Tell me.
Well, I was wondering what you thought of this new in the United States has 210,000 dentists, 80% of general dentists. About 15,000 of them have bought these CAD/CAM machines, mainly
Oh,
Sirona's Cerac.
so
And you're the founder of the Aesthetic Academy, the Italian Academy of Aesthetic Dentistry. What do you think of CAD/CAM, and is CAD/CAM aesthetic?
okay, aesthetically speaking, if you analyze only aesthetic in a pure sense, probably is not the best way to reach it. But CAD-CAM for me means quality, means standard. So you know, for the normal dentist, they can improve very easily if they move from analogical to digital, in my personal point of view, because digital is every time the same. So if you learn a little bit how to do it, and you have a good technician that could finalize in a good way the raw CAD/CAM, it means to paint. You know, today with a lithium silicate is fantastic because we use monolithic or pressed and stain in posteriors and no failures. Is an unbelievable opportunities that we have. So for the general practitioner, if they move from analogic to the digital, they can save tissue because they don't need to prepare too deep into the sulcus. They can have a digital impression today. We have scanners that are okay. For sure, if you go for full arch, probably still the normal impression is better, but CAD/CAM is improving so fast. If you remember the first scanner and until the last one is another war, totally another war. And the SEREC, you know, they sold more unit in the last 2 years than in the previous 30 years since Borman and Brandestini, they started with the first SEREC one. I was one of the first users. I published, I don't know, 30 years ago about inlays with SEREC. We had a good success after 5 years, even if at the beginning was not so precise. But today is really precise, really precise. And the materials that you have as the new composite ceramic, as an Nanic, Lava Ultimate, they are fantastic material to work with the CAD/CAM. So I strongly believe. And the new way for the CAD/CAM is not to work chairside, to have chairside the machine, but to put the impression in the web, in a cloud, and in 20 minutes, half an hour to the machine that is start to mill without the work of the dentist. So, because the problem with the CEREC that you have to lose a little bit of time or your time, chairside, try to design also in the machine. And so you lose time. For me, the time is precious. I want not to lose time there. I prefer to lose time with my patients. So to have a different kind of chairside machine, probably in the next future, will be more successful for all the dentists. Because even if it is really increasing a lot, it's still a product of few dentists. Probably in USA, you are the biggest community of CEREC users in the world, probably.
So do you think that's why Dentsply in the United States merged with Sirona, because Dentsply really had an analog world of mostly impression materials and things, and Sirona had really a digital world, which was the future. Do you think that's why they got married and merged?
You can imagine the power of Dentsply and Sirona together. They have everything for the workflow of their dentists. If they want to work with an analogic workflow, they have all the impression materials, ceramic, composite, and now with Sirona, they are leader in the world of the digital. You know, to start with the digital is not so easy today. You have to buy a platform for this. Buying or have a correlation with the Sirona that is the biggest, I strongly believe that for the supply really will be a successful challenge in the next years, for sure, sure.
You're a lot closer to Helsinki, Finland than I am. Plan Mecca bought the Dallas, Texas E4D CAD/CAM. Do you think that will be a player?
Why not? But For me, for the moment, CEREC is the leader in the market in every sense. Other company, they have unbelievable products, probably the best scanners, but they don't have the workflow. The problem for the company is to find a workflow, a digital workflow. So some of them, they have the scanner, they have the design, they have the milling machine, but some of them, they have only the scanner or they have only the milling machine. So now the dentist is not yet inside the digital workflow, in my personal point of view. What they have to do now is try to enter in the heart of the dentist, not only in the mind with the digital, because you know, if you don't create an emotion in the dentist, for them it's very difficult to start. They need to trust before in what they want to do. And the digital is still, in my personal point of view, too far from their heart. That's the problem for the digital workflow today, I suppose. But you know, there are a lot of companies that are investing billions of dollars in the CAD/CAM and the digital. So probably the future will be digital. So they decide the market normally. It's not the dentist that decide.
So what do you like to do with most of your time? I mean, you're an MD degree, you're a D.D.S degree, you're a full professor of restorative dentistry at Polytecnique University in Italy. You're a head of operative dentistry and endo department of dentistry. I mean, my God, you and you're an aesthetic dentistry. What do you like to do the most? I mean, do you still do endo? Do you still teach? Do you still do restorative dentistry, or are you mostly now private practice?
Now, in my private practice, I do only restorative and aesthetic dentistry in my private practice. And in the university, I have a lot of collaborators, strong people in different skill. I have 2 or 3 unbelievable endodontists that help me in teaching overall and follow the students, because you know I am very busy, but my job is also my hobby. That's why for me it's very easy to do a lot of things. I'm not dentist at the beginning, because in Italy at the beginning I'm medical doctor and then specialized in dentistry, because in our country the school of dentistry started in 1980s and I started before. That's why I'm medical doctor and then specialized in dentistry. But for me it was a passion. So I love to work with my hands. That's why I decided to work in dentistry, and in dentistry I choose the field where can I work more with my hands. That's all.
I feel this is so precious and valuable to have you on my show, and there's thousands of American dentists listening to you. What tips could you give them right now to be a better restorative dentist?
The only tips, the real tips that I can suggest is to save tissues. Because you can imagine how easy will be the dentistry if you work on the enamel instead of work on the dentin. Because even if adhesion is possible to have on dentin, on enamel, on cement, but the only guarantees for all our restorations, if we bond, is to bond on the enamel. So to go less prep or no prep is a magic word for the reason that we bond everything on the enamel. So our restorations are so stable. A lot of people refer us, well, when you have the bonding, I never had the bonding with my veneers. Why? Because normally I try to bond my veneers on the enamel, or if I don't do 100%, 80%, 85% or 90% over the enamel. So what can I suggest is to go with simple things and try to save tissues. And the dentistry will be really, really easier.
And
so that's our philosophy. That's why feasible, teachable, and repeatable. In this sentence, there is all the philosophy of the minimal invasive dentistry. But not as in the past, that people say, I go minimal invasive, and then they show cases when they cut teeth only to change the position. So we work a lot with ortho treatment before. When we make veneers, we prepare everything in the right position, and then we go to prep. Instead to prep to align the teeth. It's better to lose some months or 1 year before. Today with the Invisalign or system like this one, people accept really very, very well and very easy to make an ortho treatment. Why not before veneer? So veneer is not only a technique, it is really a philosophy, but behind the veneer, the philosophy is to save tissue. Otherwise, there is no reason to go with veneers if you don't save tissue. So that's really what we do every day. So what we do, we teach. Until now, a lot of people, they teach what they don't do normally. You know, there are a lot of opinion leaders that were working with some company, they never tried the material of the company that paid them during a workshop or during a lecture. So we want to work with the material that we know, and our tips and tricks are repeatable, and for sure, if you follow, you will be successful. That's the secret. Small things, well done, with a good philosophy.
I would give anything if you would make an online CE course for Dental Town. I wish every American dentist could see your lecture, and it would just be, you know, kind of merge the, get rid of the pond between America and Europe.
They're very busy, but I will give you some a workshop probably in our philosophy on indirect restorations in the next future. So why not? Will be great to show to American dentists, which is our philosophy, directly with a live demonstration on patient. So what we do, we have a learning center close to Portofino that you know is some of the best place probably in the world. And there we go live courses, and the name of the courses is the daily menu. The sense we don't know, it depends on the patient that you have during the day. So sometimes it's a veneer, sometimes it's overlay, so anteriors, posteriors, direct, indirect. It depends on the menu that we have for the day. And we did 12 or 13 courses, all of them fully booked this year. It's unbelievable, the success. And people want to come back once again to see the same course, because during our course we have a time dedicated to tips and tricks, only tips and tricks. So they stay there, they try, and they say, oh my God, it's so easy. That's the tip. It's not the tip that try is a little bit difficult, but try. No, they try and they do. That's the secret of our philosophy. We teach only simple things. But for sure, for this, we need a lot of members that they share their knowledge, because we stay just in front of class 4 restoration, 30 people say, what you want to do this? I do this, I do this, I do this. So which is the best among our techniques? Probably is your step with the tip of the other guy and the trick of the third guy. Altogether is our technique. You know, this is the power of the sharing, probably. And you know, the dentist is the king of his kingdom. Normally want not to share his work, his knowledge with the other one. That's the problem of the dentists all over the world, I suppose. Not only in Italy or in Europe, I suppose also in the United States.
So, Professor, what would you, most of the people listening to podcasts are younger kids. Most of them are under 30, and they're just got out of dental school. A lot of them are sad. Some of them are sad because they look at guys like you, they look at your work, and they say, you know, I did 4 years of college, and then I got into dental school, did 2 years, and it wasn't until junior and senior year that I started doing dentistry, and I realized I don't have the same hands as Professor Angelo does. And some of them tell me this. They say, you know what if there were two Italians, and one of them went to 8 years of painting school, and they graduated a professor of painting, and then here's some kid who never went to school, and they're just painting stuff that looks like, you know, Picasso. What would you say to that kid? Do you think a lot of what you have you were just born with, or do you think it can be trained to someone who says, look, Angelo could have painted and been a successful painter if he never went to school? What do you say to that?
Good question, Sauer. Really, I love this question, because for us, it's not the problem of the skill. For sure, we start a very high level of dentistry. because we are opinion leaders probably since 30 years in our country and in Europe mostly. And when we started, we try to emphasize our skill. So the art part of our work. Today we change completely. We try to emphasize the repeatable part of our work. That's why for us the goal is the young dentist, is the under 35. We are creating in Italy now a project with the National Association of Dentists that we do 21 courses for free to young dentists. At the end, some company, they give them the material that we have used during the hands-on, and they can go at home, try to repeat exactly the step. We give them a CD or a file at the end with what we did during the course, and with all the tips and tricks, with the design, with the movies, something like that. If you will go in our website the next month, you will see unbelievable things, because we will move from the operative dentist to prosto, to implant, to perio, exactly with the same philosophy. And you will see some of the best operators in the world explaining simple things. You can't imagine the feedback that you have with the young dentist if you teach them something that is repeatable. Yesterday went to me 3 of my old students that they stopped to study 3 or 4 years ago. And they said, "Professor, we want to be frank with you. When you was teaching us, for us you were one of the professor of the university, nothing more. Now we know that you teach us really what we have to do daily in our work, because we go in congresses when there is operative or aesthetic, and we know everything. That's fantastic. We are just coming out from the school and we know everything about what the professionals they do. We go to a perio congress and we don't understand anything, even if we had a professor in perio. Why? Because normally they teach in the same way. Look at this is the material, this is, and they never arrive until the daily work. That's the problem. You have to pay. You have to pay if you want to know. It's not correct in my personal point of view. You can earn money in different way in our job.
I wanted to ask you a question we hear all the time. A lot of people say that in the United States, the smallest percent of dentists have ever placed an implant, and then some countries, it's as high as 3 out of 4. How many dentists are practiced in Italy, and how many of them can place a dental implant? Yeah. What percentage? How many dentists are in Italy, and what percent of them place dental implants?
I suppose that from 50 to 60% of the dentists, they put themselves normal implants. It means when you have bone, single tooth. And 20% they go with big rehabilitations over implant, or I don't know, Nobel Guide, something like that. So, but for the normal implants, I suppose 60% of the dentists in Italy. But in Italy we have 100 different brands of implants that are not famous. Is a strange market, the Italian. It's very similar to the Brazilian in this sense. Brazilian, they have a lot of brands about Brazilian implants, but a lot of dentists, they are putting implant today.
Do you think titanium is titanium and all 100 of those brands probably work? Or do you think you should really stay with certain companies?
Okay, the screw is a screw. Titanium is a titanium. Probably the quality of the company, that means the way that they check if the implant is perfect, everything, the surface, the way that sandblast, acidification, what they do is important. So I strongly suggest, as for composite, as for ceramic, to work with the primary company, only because probably the standardization and the control is very high. Because if you go for a small company, how much does it cost to have a standardization inside the company. So if they produce few pieces, they have not good control, probably the failure will be just around the corner. It's not the problem of the material it works, titanium it works, and the screw it works even if the design is different. You know, today is switching, and before was another way. Before you create the tissue plain by the provisional restoration, now is narrow, allowing the tissue to grow with more space. So it changes continuously, but the quality it rests, in my personal point of view, is the only thing that we have to follow.
Do you have any favorite brands that you could recommend if someone was going to start placing implants?
Not one. I worked in my office with many companies, Nobel, ITI, 3i. I changed it a lot following the guru of the moment, as I told you before. So
I want to ask you this question. In the United States, we have 9 specialties, and a lot of people who have practiced 30 years would say that the specialty that changed the most was periodontal. That the periodontal specialist, that specialty probably changed the most. Do you think that specialty has changed the most in your long and illustrious career?
Okay, probably the two disciplines that changed more was the operative, because at the beginning only restorations as amalgam, something more, and today big rehabilitation, adhesively speaking, where full mouths with veneers, overlays, onlays, some crowns, some implant, but all the people that take care of operative now are resto people. So at the others was the perio, because at the beginning, 10, 15 different surgeons to reach I don't know what. At the beginning they try to save a lot if reducing bone that probably they will lose in 10 years. So with but the true, I suppose, that is in the middle of the history. You can save probably teeth, recreating an anatomy, but not to try to save what is not possible to save, because after that you have not enough bone to put implant, and you have to make difficult surgery, try to improve the quantity of the bone before, and then to put implant, and then the fact that on the regenerated bone probably doesn't work in the same way, is the history. And today all the periodontists are implantologists. I don't know, USA, suppose is exactly the same. Until 10 years or 15 years ago, they never put an implant before. So the implantology was for maxillofacial surgeons or for oral surgeons, but not for periodontists. Today, all the periodontists, if you go in oral surgery, perio, congresses, you see the same topic, the same people, and all of them, they speak about implants or mucogingival surgery over the implant, over the normal teeth. But the borders now are very difficult to define. So which is the limit of the periodontist, which is the limit of the oral surgeon, all of them, they put implant today.
You mentioned amalgam, restorative dentistry change,
Yeah.
amalgam. A lot of times you hear people in America that are against water fluoridation and mercury say, well, in Europe, mercury and water fluoridation are banned. You're a legend in Europe. What would you say to someone in America telling everybody that we should ban amalgams and ban water fluoridation because they're banned in Europe?
Okay, at the beginning of the problem, it was all in the Scandinavian countries that normally when you die, the problem that you fire the body and you have the mercury that goes around in the environment. It was totally different, the reason that they stopped to work with amalgam. So in Italy, we started to stop probably 15 years ago. A lot of dentists, they still working with amalgam, but really now they are 10%. I stopped to teach amalgam in the university 7 years ago. I teach only the cavity, because in my personal point of view, If you are able to create the perfect cavity for amalgam, you can do whatever you want in dentistry. That's why I still teach how to create the perfect cavity for amalgam, but in our university we teach only the composite. You know, this is an old story about allergic problem, toxicological problem. Really, there is not evidence about this kind of product. Amalgam disappear, in my personal point of view, for aesthetic reason. That's the only reason, real reason. For the rest, you know, fluoride and amalgam, they change the oral health of all the people around the world since the beginning of the last century. So why not the amalgam? The problem is today I cannot propose to my patient, you want an amalgam? No, they will kill me probably. And to work with the composite is a little bit less useful in the sense that, you know, amalgam, when you start at the beginning, it shrink a little bit, then expand a little bit more than the shrinkage. It means that is auto-sealant, the amalgam. It's the only material that auto-sealant. With the composite, you have a shrinkage, you have to manage the shrinkage. That's the problem. That's why you need a little bit more knowledge. If you work with chemistry, you need to know a little bit of chemistry. You need to know what there is inside the bottle that you use. Sometimes you ask to the people that attend to your course, what kind of adhesive you use, and they say, don't remember the orange bottle, the black bottle. They don't know the name. You can imagine if they know what there is inside. If they have a total etching system, a self-etching system, or a multi-mode, so, you know, it's only knowledge at the end of the story, dentistry. The problem that there are different ways to start in dentistry. And the result, the first result that you see is after 3 or 5 years. So in that time, you can judge the quality of the dentist, you know, and the patient changes. So normally for the dentist is not the problem if the restoration stay in the mouth a little bit less than 5 years. I guarantee all my restoration to all my patients at least for 5 years.
I want to ask you a question. Since you're a co-author of the book Adhesive Dentistry: The Key to Success, edited by Quintessence International, an amazing book and very well read. There's a lot of older dentists that claim they can do adhesive dentistry without a rubber dam. Do you agree that can be done or not, or do you say no, that's not true? What would you say? What would you say to that dentist who says I can do it without a rubber dam?
Like this to an Italian dentist, you know.
What's that? What?
We use a rubber dam. I want to explain why. So I want not to say if you don't use rubber dam, oh shit. No, I want not to say this. It's possible to make a good dentistry also without rubber dam for sure. But if we start to work in endo or in operative or in prosto, if you go adhesively, working with the rubber dam, your outcomes for sure are more than if you don't. Why? Because all the adhesive technology, they don't want contamination. The contamination is saliva, blood, clavicular fluids, so you have a lot of possibility to contaminate. You know, you etch normally, you reduce the superficial tension, you put a drop of adhesive that is high superficial tension, the wettability is unbelievable, you attain the beautiful bond. If you stay there, one drop of saliva goes there, the affinity is higher than for the bonding. It means that when you put the bonding, nothing happens because of the saliva. So if you are able to control everything, but not all in the central incisor, in posteriors, without rubber dam, why not to go without? But I lose 3 minutes or 2 minutes before, I save at least 15 minutes after using rubber dam. So for me, it's not a problem. And I want to be frank with you. All the people that we teach to use, 99% they follow to use. It means that it's not so difficult to work with. There is no reason, but you know, the 10% of the dentists in the world are using rubber dam. And probably among them, The 5%, they use it in the correct way. So
I want to. I call my show "Dentistry Uncensored," and I'm going to ask you the most politically incorrect question that I can ask. And I'm going to ask you because you're an Italian and you taught endodontics at the School of Dentistry, Polytecnique, University of Marche-Ancona-Italy. Angelo Sargenti, how will he be remembered? Some people say that his technique was faster, easier, and saved 1 billion teeth or more around the world. Other people say that was not good and should never have been done. How do you remember Angelo Sargenti? Who, by the way, I want to tell you, I want to tell you, Americans still use it every single day. They just don't talk about it.
he started in an Italian school in Pavia, Dr. Sargenti, to work with his N2 cement, you know. And when I started with N2 cement because my dean was one of the young dentists in the school of Sargenti at that time. So, but you know, the endo is changing a lot since Schiller he started with three-dimensional way to work, and now with the nickel titanium instruments, you don't need to use the cement to close the canal or to disinfect the canal. It's really changed a lot, the endo, you know, and now really the 80% of the dentists, I strongly suppose that the highest quality in the different field of dentistry as in endo, even if for the GPs. A lot of GPs, they do unbelievable endo because of nickel titanium instruments today. So I think that is nothing to say about endo today or the possibility to work with cements with some, I don't know, strange solution inside or miracle solution inside to save the tooth. I strongly believe that mechanically you can go everywhere today with the instruments that the market offer us. So.
And what did the N2 mean? What did N2 mean? What did the N stand for? Do you remember? Yeah.
I remember everything about all this part. But okay, you can go. It's not a problem. I strongly believe that our hands are the secret of the dentistry at the end of the story. So with the best technique and the worst dentist, you nothing obtain. The best dentist with the worst technique, he obtain something in dentistry. So it is our hands. Also with the dizzy, you can have the best one, but with the worst hand. I did a course last year in Dubai with my friend Lorenzo Breschi, that is very famous for his activities in research in adhesion with Franklin Tai and David Pashley. And we did a test about how the dentists, they are able to reach the perfect adhesion. We had a machine to measure in megapascal the microtensile bond strength for this. You can imagine we had 40 or 38, I don't remember, attendants to the course, and they reached from 0 to 55 megapascal with the same adhesive, the same bottle. So this is another story that adhesion is in our hands, it's not in the bottle. And all the techniques are the same. If you prepare, preparation is in our hands, it's not in the bar. You know, there are dentists that have 100 different bars for 100 different situations. I use 3 bars in my work normally. We design also 2 kits, very simple, with number 1, number 2, number 3, and number 4 bars. You have inside a sort of credit card with the image how to use the bar. Because normally to buy the bar, you see, oh my God, what kind of shape has this bar? And for what I buy, I don't know. So I eliminate 1, then eliminate 2, and then you use every time the same bar, because the learning curve, if you have a few bars, is shorter. If you have 100, you need 100 learning curves. It's the same if you use 100 materials instead to use 2 or 3 materials. More materials you have, more learning curves you need. So if you reduce everything, the quality immediately will grow. It's normal. It's not a secret, I suppose. A lot of people.
And what did you say again about average dentist and a good technique, or a good dentist and a different technique? What was that line you said?
So you have for sure different.
Did you say you'd rather have a poor dentist with a good technique instead of a good dentist with a poor technique? Is that what you said? Did you say?
Okay, if you have a technique that is very simple to follow is better. Because if you have a technique that the guru of the moment show you, and only 3 dentists in the world, they show with good results, it means that it's not a good technique. It's only because of the skill of the operator. For me, the technique is a good technique if the 80% of the dentists, they can follow this technique. Otherwise, it's a challenge every day. I want not to have a challenge with every tooth that I work daily. At the beginning, for me, it was a challenge. Try to show to the people how strong I was at the time. I don't need to show now if I'm strong or not after more than 30 years in dentistry. So now I want to show only really what works or not. That's all, nothing more.
Well, I think you're an amazing man, and I can't believe that you started with me at 9 p.m. at night, and now it's 10 p.m. I would give anything if you would give us a lecture on Dental Town. I would love to turn on all the American dentists to your philosophy of teachable, feasible, repeatable. Ken Sirota thinks you're the, you know Ken Sirota?
I know Ken.
He thinks you're... He thinks you're the greatest dentist that ever lived, and that you walk on water. He just was so excited that I got to podcast interview you. Gosh, he was excited. And I just want to thank you from the bottom of my heart for spending an hour with me today, and I really enjoyed it.
Great pleasure for me, Howard, really.
And if you're listening to this and you want to see some amazing dentistry, go to StyleItaliano.org, and you'll have it's just a smorgasbord of amazing dentistry. Thank you, Professor Angelo.
Stay tuned and follow us.
Okay, I do. And I'll see you on Facebook and your website.
Bye, Howard.
All right. Bye-bye.
Bye-bye.